So the 39-week initiative was essentially a citywide initiative that was started by the March of Dimes to say that a pregnancy that doesn't have any other reason for delivery should be carried to at least 39 weeks of pregnancy. That initiative stemmed from some research that was done that showed that babies born at 37 weeks have a roughly 1 in 6 chance of ending up in a NICU. And babies born at 37 weeks still had about a 1 in 15 chance of ending up in a NICU, compared to 39 weeks where that risk drops to 1 to 2%, depending on the situation. So with those remarkable rates of NICU admissions and good evidence that showed a 37-week baby is not the same as a 39-week baby, just like a 38-week baby is not like a 39-week baby, there started to be a push nationally that all babies should be carried to 39 weeks unless there's a medical reason for them to be delivered sooner than that. And this is one of those situations where if there's a medical indication from a maternal or even a fetal standpoint that there's something wrong and the baby needs to be delivered, we're not throwing the baby out with the bathwater. They get delivered when they need to be delivered and delivered safely. So this is meant for preventing elective deliveries, meaning deliveries that don't need to be delivered for medical reasons before 39 weeks. What it just comes down to is safety for those babies. Those babies aren't ready to be born. For a long time, the thing we primarily worried about was just lungs, and the babies being ready from a fetal lung standpoint. The majority of the reason those babies were ending up in NICUs had nothing to do with their lungs. Their lungs were perfectly fine, but they just weren't ready for being outside of the womb and ended up in a NICU, and those NICU stays could end up being weeks in length when, if mom had been pregnant for another week and a half, 2 weeks, the baby never would have had to see the inside of a NICU.